Coming up today, pregnant and diagnosed with cancer. One doctor said to end the pregnancy, but a second opinion from doctors at the University of Kansas Cancer Center saved more than one life. Good morning, I'm Jessica Lovell and welcome to the Morning Medical Update. This morning, a mother's fight and the power of a second opinion. Reggie Hong's story highlights how coordinated care can bring clarity, comfort, and save lives. Angie Racono has this story.
It's been hard. It's been hard.
Cancer is a journey.
Oh my God, like terrible, terrible feelings of like your life crumbling apart in front of you.
Rough days.
My husband and I left that room crying.
Then moments of hope.
I think my heart lifted to the ceiling.
Yeah, I'm just gonna put you on a flush.
Reggie is battling breast cancer.
I'm just really grateful.
She's also pregnant.
All right, Reggie, you are all done today.
This is her last chemotherapy treatment before her daughter is born.
Okay,
Here we go.
1, 2, 3.
Early on, one doctor suggested terminating her pregnancy.
Yeah, that was really hard. The first time we heard it, the first OB told us to like terminate. That's not what we were like hoping to hear.
Why you made that?
Was it a nest?
Reggie and her husband Alan got a second opinion at the University of Kansas Health System.
Called all my family members and I said, I'm gonna live! I'm gonna live! The baby's gonna live. You gonna do that one?
You do it, that one.
I'm doing this one, you do that one.
Reggie has found the joy in her journey.
Well, those two are gonna play together.
Time with her daughter Lily
Okay.
helps pull her through fragile moments like these.
Papa's giving mommy a haircut. Yeah, mommy's a little bit sad. This is real. I'm 35 and I have cancer and I'm shaving my head. Like, this is really happening. And you just don't think that it will happen to you, much less while you're pregnant.
Amid the anguish, support.
I'm not the one with cancer, so but sometimes it's kind of overwhelming, you know, with everything.
Okay, thank you.
Reggie was cared for by a coordinated team at the University of Kansas Cancer Center and Health System.
I think every woman, like, towards the end is like a little bit like, am I ready? Is everything ready? Hello.
Balancing cancer treatment and the health of her baby. Reggie has surgeries and hormone therapy planned after her daughter is born.
And then her body comes up this way. Here's her bottom.
That makes sense, because I think she's been kicking me on that side.
Reggie was induced at 37 weeks.
Put this baby on the monitor.
When her pregnancy was full term.
Her heart rate is good and she's pinkening up real good.
I'm your mama. Thanks for going through chemo with me. So we decided to name the baby Elena because it means torch, so a light in the darkness. And chemo and cancer treatment can be dark. And she's been the best part of cancer, or this cancer journey, is having a little baby. And I plan on ringing the bell with her when it's time, because she went through it with me.
Reggie's tumor shrank during her pregnancy. She recently had her last chemo treatment. Then it was time for the family to ring the cancer bell together.
Girl, you went through 4 rounds of AC and 6 rounds of Taxol with me. We're gonna ring this bell together. Are you ready?
Mom, Dad, Lily, and of course, Elena.
1, 2, 3. It's another step closer to being cancer-free, and we made it through, and baby's doing great, and I'm just really grateful.
And we are so grateful to have Reggie joining us along with her daughter Elena this morning. How are you ladies doing?
We're doing really good. How are you?
Well, I'm terrific. Tell us a little bit about who you are holding this morning, because she is doing very well and she's just absolutely precious.
This is baby Elena. She's 3 months old now. Very healthy, very happy baby. Lots of smiles and laughs, and she's doing great.
Well, she's doing well on her her TV debut. So we're so glad to have her this morning, and we're looking forward to hearing more about your story. Reggie, as you can imagine, you were a very popular patient here at the health system. You had a lot of doctors and medical staff caring for you, and 3 of those doctors and staff are joining us this morning here in our studio. Dr. Mark Parrish is across from me. He is a maternal fetal medicine specialist specializing in breast cancer. Dr. Megan Thomas is also a maternal and fetal medicine doctor. Dr. Thomas delivered Elena. And next to me, we are excited to have Dr. Ryan Rader, who is a hematologist and oncologist specializing in breast cancer. And just so glad to have all 3 of you here. And just what's it like to see these 2 doing so well?
It's fantastic. You know, this has been a long journey with a lot of different teams involved and a lot of different discussions and treatments. And so to have a shared goal with the patient and for everything to go as well as it did is a tremendous success.
Dr. Thomas, I want to start with you. What was the birth plan for someone like Reggie who was balancing pregnancy and cancer?
I think the biggest thing is to make sure we're watching both the mom and baby really closely, which we did. We wanted to balance what was good for the baby and what was good for mom, and that's why we chose the 37-week delivery for her. We felt like we could deliver at a really safe time in her treatment and ultimately have a term baby while also giving Reggie the timing that she really wanted.
Reggie, take us back to that magical moment when Elena was born. It just had to be such an incredible time for you.
I'm so sorry. Could you repeat that last part?
Yeah, just tell us about the moment that Elena was born, just what that moment was like for you and your husband, Alan. It just must have been so incredible to finally meet her.
It was like if we could finally breathe. Just we made it. We made it. It's so much more of a big deal than my other pregnancies because of, you know, what we'd been told before, like that we wouldn't make it. So it was incredible. Just happy to make it.
Yeah, that sigh of relief, as you mentioned. How confident were you learning that other moms had navigated both cancer and pregnancy before?
Oh yeah, so that was a huge thing when I first went to KU and spoke with a maternal fetal medicine doctor. She said, we have 3 patients right now who have cancer and are pregnant. And I was like, what? Like, so people do this, people get through this, people live, their babies are okay. And she's like, yeah, it happens more than you would think. So.
Dr. Rader, what types of cancer treatments are appropriate for pregnant moms?
Right. So pregnancy-associated breast cancers, which includes breast cancers that are diagnosed during pregnancy and up to a year after delivery, we try to treat similarly in terms of treatment options to those that aren't pregnant. However, there are certain treatments that have been proven to be safe with pregnancy, and then certain treatments that we want to wait and do after baby's been delivered. So each breast cancer is not the same. And so as a medical oncologist, I deal with treatments that affect the whole body. And so the 3 main treatment types that I have are chemotherapy, which have been around for decades, targeted therapy, and then also endocrine therapy to lower hormone levels in the body. And all those depend on what type of cancer that we're dealing with in terms of, is this a cancer that has estrogen and progesterone driving those tumors are a special type of protein called HER2 that normally exists on breast tissue but are amplified in certain types of cancer cells. And as we initially meet, we look at all this information and then we get together as a team and we decide the timing and the options that are available. So chemotherapy is scary for many, many patients as they go through it, but chemotherapy is actually one of my main treatments that I have that can actually be given during chemotherapy. Hormone blocking treatment is not something we can do, nor anti-HER2 treatments and those that we need to do it in. So knowing where Reggie was at in her journey, knowing that with her type of cancer and where it was at, that chemotherapy was going to be indicated, we used that as a bridge to safely treat her breast cancer while also monitoring, seeing how baby is doing, and then going from there.
So when we hear chemotherapy and pregnancy, it sounds scary. So are there challenges to chemotherapy for pregnant mothers?
Absolutely, and everybody goes through chemotherapy a little differently in terms of having lots of side effects or having some side effects. And when you're pregnant, you're already dealing with a myriad of other symptoms before even starting chemotherapy. One of the struggles that we can face is we have many, many supportive medications that we can bring to help treat nausea, to help treat diarrhea, to help treat all these other side effects that can arise. But each of those medications need to be considered in the context of the pregnancy and making sure that they're safe. So not only are there chemotherapy drugs, but there's all these other medications that need to be individually tailored to make sure that it's safe for mom and baby.
Dr. Parrish, what do we do as far as monitoring in these types of cases?
When it comes to these treatments, we know that they can potentially impact the growth of the kiddo. We also know that just like with mom, there's a chance that it can impact the development of certain cells, especially bone marrow cells, so things that can result in the baby becoming anemic, causing lower immunity in the kiddo as well. And so we like to monitor growth of these babies on approximately every month. We also monitor for any evidence of anemia. We have the capability of doing that via ultrasound versus looking at some blood flow patterns in the middle cerebral artery of the baby's brain. And that information helps us to know, hey, are things still safe? Can we continue to move forward? Are there any things that we need to discuss with our oncology colleagues that would help to ensure that we're having the best outcome both for mom and for the baby?
Anything else you're looking for during this time?
Well-being of the kiddo and placental function. We know that there's a potential that placental function in general could be impacted by the chemotherapy or any other therapies that we're talking about. And so we're looking at least once weekly, especially as they're getting into the third trimester and this kiddo's demanding more from that placenta, to make sure that we're not seeing any evidence of distress with the baby.
Reggie, what's it like seeing these different members of your team here with us this morning?
I'm sorry, what's it like? I'm so sorry.
No, that's okay. What's it like seeing different members of your team here with us this morning?
Oh, it's good to see you. I'm so sorry. No, you guys have all answered about 50 million questions from me before, and I just thank you for getting us through it. And I know that I still have a long journey ahead of me cancer-wise, but we got through it, and I couldn't have done it without you. I really couldn't have.
Happy to answer 50 million questions, right?
Absolutely.
Not a problem. We were talking about the support that Reggie had with her husband, Alan, and we noticed in that piece where Alan had shaved his head, and you said you hadn't, tell us that story, where you hadn't seen a patient come in before chemo treatment already having a shaved head.
So most of the time when we're going through chemotherapy, and my patients always ask me, when should I expect my hair to go out? And I'll say, it doesn't come out all at once most of the time. Usually takes a couple rounds of treatment, and what you'll start noticing is you'll start seeing hair in the sink or hair on your pillowcase or hair in the shower, and then you'll get tired of it and you'll shave it yourself. Is how I commonly coach that with my patients. And I'm getting ready to give the first round of chemotherapy to Reggie, and she comes in and her hair's bald. And I said, well, we beat that one to the punch, and we don't have to worry about that now, do we?
And what did that tell you about Reggie?
Told me that Reggie was ready to do what she needed to do to get through this and to have his little things. She was very proactive, in order to make sure that everything's addressed to the best of her ability so she can go through this and do well not only for herself but for baby Elena.
Reggie, you've been pregnant before. What was it like balancing these cancer treatments with being pregnant and also being a mom to your other child?
Well, you have to look at it two ways. So how did it affect my pregnancy? I got ultrasounds every week, so that was nice. Although you're kind of just waiting to see like, is the brain, is the blood flow to the brain going to be increased? Like there's more worry. But with chemo, I hear a lot of people like having a really tough time with it, and I have to say it wasn't so bad for me. And I wonder sometimes whether that's my age or whether the pregnancy like shielded me from it a bit. Mostly I was just tired, and I was one of the people in the chemo room who went to the bathroom about 6 times during my infusion. But for the most part, the chemo was not that hard on my body for some reason.
You handled it like a champ, like a mom would. Well, be sure to ask your questions. You can use the chat on YouTube or Facebook. You can email the Medical News Network. That information is there on your screen. We want to get to a very happy moment in your journey. Reggie and her family, including baby Elena, recently all rang the bell together, signifying the end of chemotherapy. Reggie, what is next for you in your cancer journey?
Well, between then and now, I've had a one-sided mastectomy and a little bit of reconstruction. I'll have more reconstruction later. I'm healing really well from that, and I've started Zoladex, which is a hormone treatment with Dr. Rader, and soon I'll be starting radiation, and then I'll be having reconstruction about 6 months later.
Dr. Rader, what was the goal of chemotherapy during Reggie's pregnancy, and how did she respond to it?
Yeah, I mean, I couldn't have said it better. I didn't want to speak for Reggie because I'm not the patient. I don't know what they're going through, but I saw what Reggie said, which was, like I said earlier on, that chemotherapy treats everyone a little bit differently, and so many of the symptoms, mainly fatigue, can be cumulative both in chemo and pregnancy. But I thought she did very, very well. But with Reggie's case in particular, we knew that this breast cancer had gone to the lymph nodes already, and so any premenopausal women with a hormone-driven HER2-negative cancer, the standard of care is chemotherapy. So the ability to give chemotherapy, which is a treatment that has been proven to be as safe as possible during pregnancy, made a lot of sense. In addition, the area of skin over that tumor had looked a little red, which can be concerning for breast cancer, and so it was reassuring both for me and I hope for Reggie as well that during chemotherapy we saw that redness lessen and then actually go away, which was great. And then we saw when she was able to go to her cancer surgery that there had been response to the tumor, and then also that fortunately it had only gone to just one lymph node. And so, like Reggie said, with the Zoladex and other hormone treatments, those are things that have to wait until after delivery, as well as radiation. So I'm happy that she got hopefully the hardest part of her journey behind her, and then it'll be getting on board everything else that we had to wait on, and go from there.
Dr. Parrish, how often do you see cases like this where a pregnant mom finds out she has cancer?
I don't think it's that uncommon for us to see this. I think a lot of it is we have younger, reproductively active moms still, oftentimes not necessarily getting annual exams or having symptoms that would take them to the doctor to be evaluated. And so they come in, they get routine evaluation at their prenatal visit. Maybe it's blood work, maybe it's an exam, and we find that something is wrong. I'd also say that we're a little bit biased here at the University of Kansas because we do work very closely with a lot of other subspecialties. And so sometimes a patient may be recently diagnosed with cancer and seeing Dr. Rader or one of his colleagues, and they also find out that they become pregnant. And so they automatically get referred to us to have a conversation about what this looks like for the remainder of their pregnancy.
Dr. Parrish, we always appreciate your expertise in joining our program, and I know you have some patients waiting for you in clinic this morning, so we're going to let you go a little early today.
Thank you very much.
Thank you for being with us. I'm going to get to a question for Dr. Thomas. How do you emotionally support patients like Reggie who have a more complex case?
Yeah, I think the most important thing is that we really want to have them have faith in what we're providing healthcare-wise, and making sure that all the parts of their care are taken care of, so they're not having to navigate calling multiple times in addition to going to all their visits. I think emotionally supporting somebody is super important, both from a mental health perspective, but also just allowing them to focus on the things that are important, and that's their own health, really.
So I would imagine you've delivered hundreds, if not thousands, of babies. Is this a case that's going to stand out in your mind and stick with you?
I think any time you deal with a mom who has pregnancy with a cancer diagnosis, that's going to permanently stick in your brain for sure. Definitely having Reggie be so positive throughout the experience has been making it so much easier to care for her, and definitely she will be in my brain forever for sure.
What about you, Dr. Rader?
Absolutely. For all the reasons we previously mentioned, and also because she's going to be hanging out with me for many years to come still. So our journey is part of this, but we're going to be working together, and I get to be privileged to see Elena grow up as well.
I thought you were going to say that. You get to watch Miss Elena grow up. I want to get to some questions and comments from our viewers this morning. Jeremy has a question. He says, I've heard that the doctor thinking that they needed to terminate the pregnancy is an assumption still frequently out there, that treatment and pregnancy don't mix. When someone comes to you for a second opinion, is that a common surprise that you can actually have a healthy pregnancy while doing cancer treatment?
Yeah, actually, I think it's becoming less common with people thinking that you can't have a pregnancy and have cancer treatment, but it is still definitely something we deal with on a day-to-day basis, and a lot of our patients are very surprised when we tell them what they can get in terms of treatment in the pregnancy period. And so definitely, it's getting better, and more knowledge surrounding that is more widespread, but we do still deal with those assumptions.
Angie wants to know if some chemotherapy treatments are safer than others for pregnant women.
Kind of going back to, we have safety data for a few different types of chemotherapy regimens that we use in breast cancer. We try to adhere as closely as possible because we have the most data in patients who don't have pregnancy-associated breast cancer, but many of these regimens have been around for a while, and we've been able to develop the data to know the right sort of recipe to minimize risk of both mom and baby with them.
Janine wants to know if pregnancy can fuel cancer like a breast cancer.
That's a challenging question, because we know that over the long term, being pregnant earlier, having more pregnancies, and breastfeeding are all protective factors for breast cancer. But there is a transient or temporary increased risk of breast cancer around pregnancy. So it's kind of a mixed picture.
Patty wants to know how common are cases like what Reggie and her family face.
Yeah, they're not super common, but we are blessed with a great population here at University of Kansas, and so we see a decent amount every year, unfortunately, for the patients. But what is great about it is that our team is so used to managing this that it's just like another day in the office for us.
Carolyn wants to know what kind of support Reggie and her family has received through this process. Reggie?
Oh my gosh. Well, first of all, my husband first. Just amazing everything that he's been able to help with, and he's done it all while I've been in treatment and recovering from my mastectomy. And And then, you know, his work, he works for a company called Train, and they did a fundraiser for us, and they opened us a GoFundMe, and we've received so much financial support. My family has come down. They live about 3 hours away, and his family has come down, and they live so much further, actually, to help with babysitting so I could get to my chemo treatments while I was pregnant. Then there's Cancer Action, Gilda's group, Turning Point with KU. There's just so many community groups, and even our neighbors have come and just like brought us food, and just, it's an overwhelming support that we've had. It's been crazy.
Right, it takes a village for sure. Alexis just wants to let you know she thanks you for sharing your story with us today. Kim wants to know how excited your daughter was to have a baby sister.
Hey, Lily, come here. Come here for a second. Somebody wants to know, how excited were you to have a baby sister? Were you really excited? Yeah? She was really excited. We have baby dolls that we got her, you know, to practice for having a baby sister, and she named them all Baby Elena. Every single baby doll is Baby Elena.
I love that. I love that. Reggie, we're just so thrilled to share your story, and we just can't thank you enough for being with us today. And if Lily wants to step into the picture, we would love to see her. And we just want to hear from you, just what you want the big takeaway from your story to be today. What do you want people to know?
I just want people to know that pregnant women do get cancer, and people with cancer do get pregnant. So it happens, and it's not the end of the world. You can get through it, and it can just be a part of your story. But yes, I'll open that for you. Yes, you can get through it. You're going to be all right.
Well, thank you again. And we'll let you get back to being a mom, opening the chips, holding the baby, doing 100 things today, because I know that's what you're going to be doing. Dr. Thomas, what's the big takeaway?
I think ultimately just sharing your goals. If you do become pregnant and do have this terrible diagnosis, we are here to support you, and we're here to get you through that. It's the most important thing.
Dr. Rader, what's the big takeaway today?
Pregnancy comes with its own hosts of lots of scary things, including pregnancy-associated breast cancer. So listening to your body, when you feel something that's not right, bring it up, bring it to your doctor so they can evaluate. And then when it comes to making these very critical decisions, making sure that you have a team that supports you, and like Dr. Thomas was saying, sharing those goals with them, and then we work together with our patients to do the best we can.
Thank you both for your expertise today. Great to have you both. Thank you to all of our guests for being with us. We want to thank our viewers for being with us today as well. Coming up tomorrow on All Things Brain Health, after years of seizures and confusion, David Dandaran finally got his answers. A rare autoimmune disorder leads to effective treatment and a return to normal life. Neurologists break down the warning signs, the complex diagnosis, and how targeted treatment can be life-changing.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.